Hello everyone, this is Sapna from RPIIT Medical and Technical Campus. In previous class, we have discussed about some details about glucose tolerance tests. In this video, we are going to discuss about the methods and procedures of glucose tolerance test. First of all, we will discuss about the procedure of standard oral glucose tolerance test. At about 8 am, the fasting blood sample and urine sample are collected. These are called zero samples. A loading dose of 75 gram anhydrous glucose dissolved in 250 to 300 ml of water is given to the patient for drinking in 5 minutes, sip by sip. Then we will discuss about the procedure. In children, the amount of this glucose load is 1.75 gram per kg. Body weight is given. In classical procedures, the blood and urine sample are collected at half-hourly interval of the next 2.5 hour or 3 hour. Glucose is estimated in all the blood samples. Urine is analyzed for the presence of glucose. Now we will discuss about the glucose tolerance curve. A curve is plotted with the blood glucose level on the vertical axis against the time of collection on the horizontal axis. The curve so obtained is called glucose tolerance curve. Now we will discuss about the lab profile of a normal person after glucose load. And here we can see the lab profile of a normal person after glucose load. Here we have taken a fasting sample which is known as zero sample of blood and urine. Here when we estimated blood glucose level, in blood sample the blood glucose level is 90 milligram per deciliter, but in urine there is no glucose. Then after 30 minutes we have taken the next sample. Here in blood sample, blood glucose level is 100 milligram per deciliter. In urine, blood glucose level is nil. At the interval of 60 minutes, in blood glucose is 150 milligram per deciliter. In urine, glucose is nil. At interval of 90 minutes, blood glucose is 120 milligram per deciliter, but in urine we can see the blood glucose level is nil. Then at the interval of 120 minutes, level of blood glucose is 110 milligram per deciliter in blood, and in urine it is nil. Then at the interval of 150 in blood, glucose is 80 milligram per deciliter. In urine it is nil. And at the interval of 180 minutes, blood glucose is 70 milligram per deciliter, but in urine it is nil. And here we can see in the graph the blood glucose become normal in profile of a normal blood glucose person. Then we will discuss about the lab profile of a diabetic patient after glucose load. Here we have also taken the fasting sample when we tested blood glucose level. Blood glucose level in is 200 milligram per deciliter, and in urine we can see the glucose is positive. At the interval of 30, blood glucose level in diabetic patient is 225 milligram per deciliter, and in urine glucose is positive. Then we taken the sample at the interval of 60 minutes, 90 minutes, 120 minutes, 150 minutes, and then 180 minutes. But here we can see the level of blood glucose is not normal. It is abnormal here. At the interval of 180 minutes after peak point, the level of blood glucose is 225 milligram per deciliter, and it is positive in urine also. Now we can see here its graphical representation. Then we will discuss about the intravenous glucose tolerance test. This test is undertaken for patients with malabsorption, celiac disease and enteropathies. Under these conditions, oral glucose load is not well absorbed. The result of oral glucose tolerance test become inconclusive. Now we will discuss about the procedure of intravenous blood glucose test. Intravenous glucose tolerance test is carried out by giving 25 gram of glucose dissolved in 100 milliliter of distilled water as intravenously injected within 5 minutes. Completion of infusion is taken as zero sample. Blood sample are taken at 10 minutes interval for the next hour. The peak value is reached within a few minutes and the value touches to near normal in 45 to 60 minutes. Interpretations: in normal individual, blood glucose level returns to normal within 60 minutes. In diabetic patient, it declines slow. The initial values are attained in 120 minutes. Now we will discuss about the factor affecting of glucose tolerance test. These factors are acute infections, liver disease, hypothyroidism, and then starvation. Then we will discuss about mini or modern glucose tolerance test. As per current WHO recommendation, in the mini or modern glucose tolerance test, only two samples are collected. One sample is fasting or 0 hour and the next sample is 2 hour post glucose load. Urine sample are also collected during the same time. The diagnosis is made from the variations observed in these results. And now we will discuss about the diagnosis is made from the various now we will discuss about the expert committee criteria. Here we can see the flow chart. In this, time of sample collection is here. Then we will discuss about the normal person's blood glucose level, criteria for diagnosing diabetes mellitus, and criteria for diagnosing impaired glucose tolerance. Here we can see in the fasting sample in a normal person is blood glucose level is less than 110 milligram per deciliter, or we can say 6.1 millimole per liter. And the criteria for diagnosing diabetes mellitus is the blood glucose level of fasting should be more than 126 milligram per deciliter, or we can say more than 7.0 millimole per liter. And the impaired glucose tolerance test of a normal person is 110 to 126 milligram per deciliter. Then 2 hours after glucose load in a normal person, blood glucose level is less than 140 milligram per deciliter, or we can say 7.8 millimole per liter. Criteria for diagnosing diabetes mellitus after 2 hour glucose load is more than 200 milligram per deciliter, and criteria for diagnosing impaired glucose tolerance is 140 to 199 milligram per deciliter. Now we will discuss about the criteria for diagnosing of diabetes mellitus. If the fasting plasma glucose level is 126 milligram per deciliter or higher, or more than one occasion, further evaluation of the patient with a glucose challenge is necessary. However, when the fasting plasma glucose is less than 126 milligram per deciliter, in suspected cases, a standardized oral glucose tolerance test may be done. A random plasma glucose concentration more than 11.1 millimole per liter or 200 milligram per deciliter, accompanied by classic symptoms of diabetes mellitus, polyuria, polydipsia, weight loss, insufficient for diagnosis of diabetes mellitus. Thank you.